Well, let's begin with Ghana. It's received the first COVID-19 vaccines through the COVAX program. This is a WHO scheme designed to help distribute doses fairly between richer and poorer countries. This was the arrival of 600,000 doses of the Oxford AstraZeneca jab, landed by plane in the capital, Accra. A government delegation led by the health minister was there to receive them. While Ghana has a population of 31 million, it was chosen as the first recipient after promising quick distribution. Its vaccination drive will start on March the 2nd, and frontline health workers and the vulnerable will be first in line. Here's Thomas Nadi in Accra.
The initial target is to vaccinate 20 million people out of the country's 30 million population. A number of new variants have been identified in the country, among them the more infectious British variant. On Friday, Ghana's health service said that while infections had peaked, hospitals were still recording a high number of cases. The country has recorded over 80,000 cases of the virus and 582 deaths since the outbreak in March.
Well, the doses came from the Serum Institute of India. That's the world's biggest vaccine manufacturer. Here they are being packed into boxes at a facility in Pune. We're told other shipments from the factory are due to arrive in other parts of Africa soon. Well, the WHO and the UN's children's charity UNICEF are calling this moment a milestone. Here's a statement from UNICEF in which it says, in the days ahead, frontline workers will begin to receive vaccines and the next phase in the fight against this disease can begin, the ramping up of the largest immunization campaign in history. Well, the delivery is 8 months after the beginning of COVAX. Its aim is to ensure that everyone in the world gets vaccines regardless of their wealth or their country's wealth. And this is how it works. COVAX pools funds from wealthier countries to help buy vaccines for themselves, but also for lower GDP nations. Its goal, an ambitious one, is to deliver 2.3 billion vaccines to people in 190 countries by the end of this year. Most of those doses will go to lower income countries and they will not pay for them. Success hinges, of course, on international support. These countries have signed up. They have a choice of paying for their own jabs, and those of countries who are unable to afford them, or only paying for the doses of poorer countries. So far, they've committed over $10 billion. That may seem like a lot. However, it's still 800 million short of this year's target. Well, as well as the cost, there are, of course, huge logistical hurdles to overcome. Here's the view of one not-for-profit organisation which campaigns to end poverty in Africa.
When vaccines become available, say, for instance, from India, the AstraZeneca vaccine, when it becomes available, which countries are ready, are prepared with a plan to be able to distribute immediately? Those are the kind of considerations that come into it. Now, for India, for instance, it has its own plan as a country, either as part of COVAX or on its own. The African Union has its own plan as a continent, whether as part of COVAX as well as independent procurement mechanisms. So it depends on what is available, who is able to make theirs available as at when it is due, and who has the plan to be able to distribute it as soon as it arrives. Those are the kind of considerations that take place.
Now, we know that richer countries have been able to buy far more COVID jabs than lower income ones. Here's The Economist on the scale of the issue. It tells us the 54 wealthiest countries are home to 18% of the world's adult population, but have ordered 40% of all available vaccines. And it blames vaccine hoarding for an unequal rollout. There's plenty of evidence to back that up. Look at this graph. Canada has ordered 338 million doses. That's enough to vaccinate its population 5 times over. And the UK and the EU and Australia have all ordered enough to vaccinate their populations more than twice over. And the WHO has been vocal on this issue.
Some high-income countries are entering contracts with vaccine manufacturers that undermine the deals that COVAX has in place and reduce the number of doses COVAX can buy. Even if we have the funds, we can only deliver vaccines to poorer countries if high-income countries cooperate in respecting the deals COVAX has done and the new deals it's doing. This is not a matter of charity. It's a matter of epidemiology.
Well, there's been plenty of scrutiny on this issue. While most first doses are going to low or middle-income countries, some wealthier countries are benefiting from COVAX too. We're told Singapore has requested an early allocation. And here's an article on the New Zealand website stuff.co.nz.